Have you ever taken a medication, believing it was helping you, only to later discover it could be silently harming your heart? Could the very pill meant to relieve your pain, reduce your anxiety, or control your blood pressure be putting you at risk for a heart attack? Every year, in the United States alone, over 800,000 people experience a heart attack. Many without warning, many without ever realizing the danger they were in. While we often blame poor diet, lack of exercise, and genetics, there's another insidious factor that millions overlook. Common medications that may be quietly increasing your cardiovascular risk. These aren't obscure or experimental drugs. They are widely used, easily accessible, and found in medicine cabinets everywhere. The truth is, some of the most prescribed medications in the world may be silently working against your heart. Today, we're uncovering the shocking connection between 8 widely used medications and their potential to heighten heart attack risk. But this isn't just a simple list. We'll dive deep into the science, real-life cases, and safer alternatives, empowering you to make informed choices about your health. If you or someone you love takes medication regularly, don't look away. This information could change the way you see your prescriptions, and may even save a life. Let's get started. 1. NSAIDs. The hidden danger lurking in your medicine cabinet. Pain is a universal experience, and when it strikes, whether from an injury, a persistent headache, or chronic joint inflammation, many instinctively turn to over-the-counter pain relievers. Among these, non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Advil, Motrin, and naproxen, Aleve, are among the most widely used. They are trusted by millions, but few realize that these seemingly harmless medications could be quietly increasing their risk of a heart attack. The science behind the risk. NSAIDs work by blocking enzymes, COX-1 and COX-2, involved in producing prostaglandins, which regulate inflammation, protect blood vessels, and maintain healthy circulation. However, by disrupting this balance, NSAIDs also interfere with key cardiovascular functions. A 2017 study published in the British Medical Journal, BMJ, found that taking NSAIDs for as little as 1 week could increase the risk of a heart attack by 20% to 50%, depending on the dose. This occurs because NSAIDs can lead to fluid retention, higher blood pressure, and arterial constriction, all of which place additional strain on the heart. Over time, this can promote clot formation, significantly increasing the likelihood of a heart attack or stroke, even in individuals without pre-existing heart disease. The good news is that pain relief doesn't have to come at the cost of heart health. While NSAIDs can be effective, they should be used cautiously, especially for those with high blood pressure, heart disease, or a history of stroke. Consider these safer options. Use NSAIDs sparingly, at the lowest effective dose and for the shortest duration possible. Opt for acetaminophen, Tylenol, which does not carry the same cardiovascular risks. Incorporate natural anti-inflammatory solutions such as turmeric, ginger, omega-3 fatty acids, and magnesium, all of which can help reduce pain and inflammation without compromising heart health. Explore physical therapy, stretching, and lifestyle modifications for long-term pain management. Always consult your doctor before using NSAIDs frequently, particularly if you have a family or personal history of cardiovascular disease. 2. Antidepressants. A hidden risk for the heart. Antidepressants have transformed mental health treatment, offering relief to millions battling depression and anxiety. Among the most widely prescribed are SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors, including fluoxetine, Prozac, sertraline, Zoloft, and venlafaxine, Effexor. While these medications can be life-saving, what many don't realize is that they may also pose risks to heart health. How antidepressants affect the heart. These drugs don't just regulate brain chemistry, they also influence cardiovascular function. By increasing serotonin and norepinephrine, they help stabilize mood but can also raise blood pressure, disrupt heart rhythms, and affect blood clotting. A 2018 study in JAMA Psychiatry found that SSRIs may increase the risk of arrhythmias, blood clot formation, and elevated blood pressure. Additionally, they reduce platelet aggregation, which may heighten the risk of excessive bleeding, including hemorrhagic stroke. The risk is higher for older adults and those with hypertension, arrhythmias, or a history of stroke. If you fall into these categories, certain antidepressants may be safer than others. Antidepressants remain essential for many, but managing cardiovascular risks is key. Never stop antidepressants suddenly. Gradual tapering is critical. Explore alternatives like cognitive behavioral therapy, CBT, mindfulness, and exercise. Monitor blood pressure and heart rate, especially with long-term use. For those at risk, certain options like bupropion or mirtazapine may have fewer cardiovascular effects. Balancing mental health and heart health is possible, but it starts with awareness and informed choices. 3. Calcium channel blockers. A double-edged sword. Calcium channel blockers, CCBs, are widely prescribed to manage high blood pressure, angina, chest pain, and certain heart rhythm disorders. Medications such as amlodipine, Norvasc, diltiazem, cardizem, and verapamil are commonly used to relax blood vessels and reduce the workload on the heart. While these drugs can be essential in controlling hypertension, they are not without risks, especially when used in high doses or for prolonged periods. The connection between CCBs and heart attack risk. CCBs function by blocking calcium from entering the heart and arterial cells, causing blood vessels to widen and blood pressure to drop. However, in some cases, this process can lead to unintended cardiovascular consequences. A study published in Circulation revealed that short-acting CCBs were associated with a 25% increased risk of heart attack in certain individuals. The reasons: these drugs can cause fluid retention, exacerbate heart failure, and lead to dangerously low blood pressure, which may trigger dizziness, fainting, or even cardiac events. Some CCBs may also disrupt heart rhythms, increasing the risk of arrhythmias in susceptible individuals. How to minimize the risks. For those who need calcium channel blockers to manage their condition, careful monitoring and lifestyle adjustments can help reduce potential dangers. Watch for side effects such as swelling, dizziness, or irregular heartbeat. Report them to your doctor immediately. Consider alternative blood pressure medications, such as ACE inhibitors or beta blockers, if CCBs cause complications. Maintain a heart-healthy lifestyle by reducing sodium intake, staying physically active, and managing stress, which can complement medication therapy. If you have a history of heart failure or low blood pressure, discuss with your doctor whether a different class of medication may be a safer option. While calcium channel blockers can be life-saving for some, they require careful management to ensure they provide benefits without increasing cardiovascular risks. An informed approach can make all the difference in long-term heart health. 4. Diabetes medications. The blood sugar trap. Managing diabetes is crucial for overall health, but not all diabetes medications are created equal. Some may pose unexpected risks to the heart. While these drugs are intended to help regulate blood sugar levels, certain medications, particularly those in the thiazolidinedione (TZD) class, have been associated with an increased risk of heart attacks and cardiovascular complications. The hidden cardiovascular risk. One of the most concerning diabetes drugs is rosiglitazone, Avandia, which was widely prescribed for years before research uncovered its serious impact on heart health. A 2007 study in the New England Journal of Medicine found that rosiglitazone increased the risk of heart attacks by 43% and cardiovascular-related death by 64%. This alarming data led to severe restrictions on its use, although some limitations were later lifted. The primary issue with these medications lies in their ability to cause fluid retention and increase blood pressure, both of which can strain the heart and worsen heart failure over time. For individuals with pre-existing heart conditions, these drugs may create a dangerous situation, one where lowering blood sugar comes at the cost of increased cardiovascular stress. For those managing diabetes, protecting heart health should be just as important as controlling blood sugar. Here's how to minimize risk while keeping blood glucose in check. Consider safer diabetes medications, such as metformin, which is generally well tolerated and has been shown to reduce cardiovascular risks. SGLT2 inhibitors, e.g., Jardiance, Farxiga, and GLP-1 receptor agonists, e.g., Ozempic, Trulicity, have been shown to not only control blood sugar but also provide heart protective benefits. Monitor for signs of fluid retention or worsening heart function, especially if you are on a thiazolidinedione. Adopt a heart-friendly diet and regular exercise routine, which can significantly improve both diabetes management and cardiovascular health. By making informed choices about diabetes medications, individuals can achieve balanced blood sugar levels without compromising their heart health. 5. Decongestants, a hidden threat in cold medications. When a stuffy nose strikes, many people instinctively turn to decongestants for fast relief. Over-the-counter medications containing pseudoephedrine, Sudafed, and phenylephrine are widely used to reduce nasal swelling and open airways, helping people breathe more easily. However, what many fail to realize is that these medications don't just target nasal passages, they also affect the cardiovascular system. How decongestants impact the heart. Decongestants work by constricting blood vessels to reduce swelling in nasal tissues. Unfortunately, this same effect occurs in blood vessels throughout the body, leading to increased blood pressure and heart rate. For individuals with hypertension, heart disease, or an irregular heartbeat, this can place dangerous stress on the cardiovascular system. A study published in the American Journal of Medicine found that decongestant use significantly raises blood pressure, particularly in people who already have hypertension or other heart-related conditions. Additionally, these drugs can trigger arrhythmias and, in rare cases, lead to a heart attack, especially when combined with caffeine, nicotine, or other stimulants. If you have high blood pressure or other cardiovascular concerns, it's crucial to seek safer ways to manage nasal congestion. Use saline nasal sprays, which provide relief without affecting blood pressure. Try steam inhalation or humidifiers, which help clear nasal passages naturally. If allergies are a factor, consider antihistamines, which can reduce congestion without causing vasoconstriction. For those with heart conditions, decongestants may do more harm than good. Choosing gentler, heart-friendly remedies can ensure that managing a simple cold doesn't put unnecessary strain on the heart. 6. Chemotherapy drugs, the cancer treatment conundrum. For millions battling cancer, chemotherapy can be a life-saving intervention. However, while these powerful drugs attack cancer cells, some also take a toll on the heart. Certain chemotherapy agents, particularly anthracyclines like doxorubicin, adriamycin, and fluorouracil, have been linked to serious cardiac complications that can develop during or even years after treatment. The risk of chemotherapy-induced cardiotoxicity. Chemotherapy drugs are designed to destroy rapidly dividing cells, but in the process, they can cause unintended damage to heart tissue. A study in JACC Cardio-Oncology found that up to 26% of patients treated with doxorubicin developed heart failure. Meanwhile, fluorouracil has been associated with coronary artery spasms, which can restrict blood flow to the heart and trigger a heart attack. The effects of cardiotoxicity may not be immediately noticeable but can manifest as shortness of breath, swelling, fatigue, and irregular heartbeats over time. For cancer patients and survivors, these cardiac risks add another layer of complexity to their health journey. How to protect the heart during cancer treatment. Although chemotherapy-related heart risks are concerning, proactive measures can help minimize the damage. Regular cardiac monitoring, such as echocardiograms, can detect early signs of heart strain before symptoms appear. Cardioprotective medications like dexrazoxane can help shield heart tissue from chemotherapy-induced damage. Maintaining a heart-healthy lifestyle, including exercise, a nutrient-rich diet, and avoiding smoking, can strengthen cardiovascular resilience. Cancer treatment should not come at the cost of heart health. By working closely with healthcare providers, patients can navigate their treatment options while taking steps to protect their hearts for the future. 7. Testosterone and anabolic steroids, a risky performance boost. Testosterone is a crucial hormone for muscle growth, energy levels, and overall vitality. While testosterone therapy is sometimes necessary for those with clinically low levels, the increasing misuse of anabolic steroids and testosterone supplements, particularly among athletes and bodybuilders, has raised serious concerns about cardiovascular health. The hidden dangers of testosterone therapy and steroid use. Although these substances can enhance muscle mass and physical performance, they also thicken the blood, elevate blood pressure, and increase the risk of blood clot formation, all of which heighten the chances of a heart attack or stroke. A 2017 study published in JAMA Internal Medicine found that men who began testosterone therapy experienced a 30% increased risk of heart attacks and strokes within just 3 months of use. Long-term steroid use has also been linked to atherosclerosis, narrowing of the arteries, abnormal heart rhythms, and an enlarged heart, conditions that can lead to sudden cardiac events, even in younger individuals. How to safely support testosterone levels. For those seeking to naturally maintain or boost testosterone levels, there are healthier alternatives. Engage in regular strength training, which has been shown to naturally stimulate testosterone production. Incorporate healthy fats, such as those from avocados, nuts, and olive oil, into your diet to support hormone balance. Prioritize quality sleep and stress management, both of which play a key role in maintaining optimal testosterone levels. If medical testosterone therapy is necessary, it should only be done under strict doctor supervision with regular cardiovascular monitoring. Avoid anabolic steroids altogether, as the risks far outweigh any potential benefits. The pursuit of muscle growth and vitality should never come at the cost of heart health. Making informed choices ensures that efforts to enhance strength don't lead to irreversible cardiovascular damage. 8. Proton pump inhibitors, PPIs, the silent artery stiffeners. Proton pump inhibitors, PPIs, are among the most widely used medications for acid reflux, GERD, and ulcers, offering relief to millions suffering from chronic heartburn. Drugs such as omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid, effectively reduce stomach acid production, but their long-term use has raised serious concerns about cardiovascular health. The hidden cardiovascular risk. While PPIs are generally considered safe for short-term use, research has linked prolonged dependence on these medications to an increased risk of heart attacks. A comprehensive study from Stanford University, which analyzed over 3 million medical records, found that individuals using PPIs had a 16% to 21% higher risk of heart attacks, even in those with no prior history of heart disease. How PPIs affect the heart. One of the key mechanisms behind this risk lies in PPIs' effect on nitric oxide production, a crucial molecule that helps keep blood vessels flexible and dilated. By reducing nitric oxide levels, PPIs may contribute to stiffer arteries, higher blood pressure, and an increased likelihood of blood clot formation, all of which raise the risk of cardiovascular events. Safer alternatives for acid reflux relief. For individuals who require long-term acid reflux management, there are heart-friendly alternatives. Consider H2 blockers, e.g., famotidine, as a potentially safer option for acid suppression. Make dietary and lifestyle adjustments, such as avoiding trigger foods, spicy, acidic, or fatty meals, eating smaller portions, and not lying down right after meals. Explore natural remedies, including ginger, aloe vera, and probiotics, which may help support digestive health without increasing cardiovascular risks. While PPIs serve an important role in treating acid-related conditions, they should be used cautiously and only when truly necessary. Understanding the hidden risks allows individuals to make informed choices that protect both their digestive system and their heart. Final thoughts. Protect your heart. Protect your life. Every pill we take has an impact. Some heal, while others carry risks we rarely consider. The medications discussed today may be commonplace, but their potential to silently harm your heart is something no one should ignore. Knowledge is power, and by understanding these risks, you have the ability to make informed choices that can safeguard your heart for years to come. Your health is in your hands. If you found this information valuable, let's keep this conversation going. Drop a comment below with your thoughts or experiences. And if you believe this message could help someone you care about, share this video with them. For more science-backed health insights, don't forget to subscribe and turn on notifications so you never miss an important update. And if this video helped you today, a like would mean the world. It helps us reach more people who need this information. Stay informed, stay proactive, and as always, take care of your heart, because it takes care of you.